it's really the mindset of hope, perseverance, and really kind of being able to chase the results that you want to get.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. Now, this episode is brought to you by Edna Digital Marketing. To learn more, visit ednadigitalmarketing.com or email us at info@ednadigitalmarketing.com. Now, I have Dr. Richard Kang here of Core Medical and Wellness. He is an anesthesiologist who was voted chief resident at the University of Maryland and fellowship trained in pain management at Columbia University. He is also a husband and father of 3 and an avid Brazilian Jiu Jitsu practitioner. Welcome, Dr. Kang.
Hey, Daniel. What's up, man?
Yeah, glad to have you here. So I got to ask, how did you end up getting into Brazilian Jiu Jitsu?
Yeah. So interesting story. I finished my fellowship. My partner in our medical practice is Dr. Jag Desai, and we were just, hustling, trying to get our practice up and running. And just like anyone else, you kind of get into that little bit of a rut, just doing the same thing over and over again, working out, exercising. And it was more of like a basic routine and just being monotonous. So on my way from the hospital to our medical practice, I would pass a sign that said Brazilian Jiu Jitsu. And I would pass it for years and just never really thought about it, never really watched UFC, didn't know a single thing about it. And one year, it must have been after January 1st, you've already made those New Year's resolutions. And I'm like, you know what? I'm going to go up there and see what this Brazilian Jiu Jitsu is about. Walked in, they gave me a demo class, they choked me out. And I was like, oh my gosh, I love this thing. Sign me up. So ever since then, man, it's been, my passion, been trying to, you're learning self-defense. You are part of a community. It's a fantastic workout, trying to fight another human individual from either choking you or breaking your joints. It takes a lot of energy. So with the combination of the 3, just been trying to stay healthy enough to continue to be a part of that community.
Mm-hmm. Well, that's fantastic. Yeah, I'm not sure. Would you recommend that to your patients though?
The thing is, like, as we'll kind of delve into a little bit later today, I take my own medicine. I recommend everyone to be active, regardless of whatever sport it is. And there's always things that you can do and modify, and it sounds more brutal than it is. But I mean, they call it the gentle art for a reason, is because if you're using technique, you don't necessarily have to use brute strength. You can go up against a heavier fighter if you're on the lighter stature side. So yeah, usually when you're coming to see us, there's a problem already. So if we're able to kind of get you back on that path, 100%, I definitely recommend Brazilian Jiu Jitsu. We have a lot of guys from schools, other visiting schools in our academy that occasionally get injured, and on their path, we try to get them back on that path and the goal is really the same, to get back to activity. But yeah, I mean, if you're my father, you're in the 80s and you wanted to start it, I would never say no to anyone, but I would say, hey, maybe we give it a little second thought.
Okay, got it. Now, Dr. Kang, I really want to know, how did you get interested in this particular field of medicine?
Specifically pain management. So once I got into my residency for anesthesiology, during your anesthesiology residency, you rotate all throughout different subspecialties of anesthesia: pediatric, cardiac, OBGYN. Pain management happens to be one of the fields where it started within the primary specialty of anesthesiology. And during my residency, University of Maryland had a fantastic interventional pain management program. Really got excited. It was my opportunity to go outside of the operating room, but also, instead of being behind the curtain where you're really kind of helping with maintaining the patient's life during surgery, now as a pain management physician, you get to be on the other side of the curtain. You can be the surgeon, you can go outside of the OR, have clinic hours, etc. But it was really, I think for me, the motivating factor was getting people back to activity levels. There's definitely a joy and satisfaction that you get from really saving the life or keeping someone alive during either an elective procedure or emergence procedure as an anesthesiologist. And then there's a totally different aspect that you have as a pain management physician, where you're more intimately involved as a team member as opposed to that one certain period of time.
Okay, got it. Now, when it comes to your practice in particular and the patients that you're helping, could you discuss some of the most popular treatments that your patients come to see you for, and also why do you think it's the most popular?
So we're going down a pretty deep rabbit hole here, but just scratching the surface a little bit. The predominant problem that we see in our office is usually spine related, either degenerative wear and tear over time, arthritis problems, disc herniations from trauma. It could be sports related, it could be trauma related, like getting into a car accident. And again, it could just be wear and tear. So 90% of what we see in the office is some sort of spine related, either traumatic, acute, or degenerative changes. And associated with that is like the most popular treatments people have heard or word on the street is, hey, I need an epidural, I have sciatica, I have neck pain, back pain, nerve blocks, things like that, to try to help not only acutely address the patient's pain complaints, but also try to get them back on track. So we're part of a team where you could get them back to their physical therapist, get them back to their chiropractic doc, so that collectively all of us together are trying to get the patient kind of not only more pain-free or as pain-free as possible, but more in a functional status. So the more popular procedures that we have are these things called facet injections, nerve blocks, epidural steroid injections, specifically related to spine-related pathologies.
Got it. Now, when people think about pain management, there's always a little bit of that dark side of, well, just pain pills, give me pain pills for my pain. But what is your philosophy when you look at treating people with chronic pain?
That's an interesting question, and it continues to evolve as we speak. Originally when I first came out of fellowship, and this was in 2005 and 6, there were things that were happening with medical management, specifically in relationship to opioids. And there was a lot of literature that was just starting to come out that was saying, well, yes, there might be habit forming, dependency forming stuff. Obviously, we've already been through this environment where we're already aware of the opioid epidemic that occurred with prescription drugs, but also things that are happening currently, in the state of the nation, cities like Philadelphia, San Francisco, where there's a real illegal street opioid epidemic. I do think that medical management has a very specific role, and it's a customizable plan that every doctor, along with their relationship with their patient, should have specifically focused on trying to tailor a plan that's worthwhile for them. Obviously, I think there's part of it is a clinical scope. Well, do you really want to be tethered to a medication that is a controlled substance to help you maintain your pain relief? And in certain specific instances, it is a really great valid therapy. There's the acute side of it where, as an anesthesiologist, after you had a surgical procedure, hey, yeah, you need something to get over that acute period. But then the pathology for chronic pain, people who develop a chronic pain syndrome because of whatever may have occurred after a surgical procedure or after an injury or trauma, may lead to this area that we label chronic pain. And there is definitely a role for medical management. However, again, it's that you're tethered, you're kind of chained to this medication to kind of get by. And my philosophy over the years has definitely changed, because when we first came out of residency training, you come out of fellowship, a lot of the things that we're taught in our toolbox is to help with symptom management. And how do we manage your symptoms? But then, we're trained to try to make a diagnosis, but ultimately, if we're just focusing on symptom management, it never really comes to the basis that we're treating their underlying disease process. Mm-hmm. So, for me, I do think with medication management, specifically opioids, there is a specific customizable role. But if we're able to do without, try to do with interventions, try to do with complementary therapies on a more of a conservative basis, and really kind of get them out of our office and kind of back onto their path of or journey is the most ideal way. And that's how my thinking has changed over time.
Got it. So it sounds like you're focusing a bit more on treating the root cause of it and also coming up with a customized plan for every single person. Do you think that that approach to it is really what differentiate your practice from others in the industry?
Yeah, I mean, it's hard to say. There's a lot of really trained physicians out there, and it's hard to say like, hey, I'm better or smarter than other people, which I am definitely not. I think one of the things that is a differentiator for us, Core Medical and Wellness, my partner physicians, is that we spend a little bit more time with attention to detail and really kind of customizable plan that is for every individual patient. And I know that, a lot of physician offices kind of say this, but for us in practice, that's what we like to do, because ultimately, if we're having a person that we're treating for chronic pain, and yes, they may have monthly or quarterly visits with us for a maintenance program, but it's kind of like the analogy that I use for diabetes. Right now, there's definitely things that we can do to stem off developing lifelong dependency on medications if we're able to catch it early on, preventative diet, lifestyle modifications, etc. And there are things that we can do to add value and educate our community, specifically within the pain management world, to try to get to the point where, hey, you might not need that medication management. But specifically for us, I think it's really kind of attention to detail, speaking with the patient, trying to come collectively with a team, a really effort. We don't know everything. I specifically don't know everything. Medicine continues to evolve. So even if I don't know anything and there's another pain doc, maybe it's down the road, who's a specialty in this very particular thing, I have no hesitation referring out to them, because I know that's what's going to help get the patient better. And I think that's what really kind of differentiates us, really choosing our team members really carefully and knowing our limitations where, hey, I think we've drawn to like the best of our abilities. Now I think you might need extra care that requires like another specialist.
Got it. Now, you brought this up, this point of as far as educating your patients, and I'm sure you've had a lot of patients come in where they maybe had some misnomers about pain management or the treatments, or just maybe have no knowledge of the treatments at all. How do you handle that with someone that comes in with either they have no idea what goes into it, or they have maybe a wrong mindset of really what it takes? Like, how do you handle that with your patients with that mindset?
Yeah, I mean, I think that's a really good question. And a lot of the times, even no matter, we're in this world, like you're in the digital marketing world and I'm in this world of pain management. And for us, it's kind of second nature, these definitions and things that we do. But in general, for the general public, again, right now, pain management has this negative connotation, especially linked to medical management, specifically amongst opioids. And I think one of the best things that we do in combination with efforts for yourself is being able to provide value, specifically stuff on our blog site, stuff on our website, detailed information about what we do, our approach. But at the end of the day, it really is that conversation that takes place within the patient room where we're able to dive down, take our time, answer any questions, kind of, dispel any myths that are out there, and really kind of explain to them, hey, our focus is this way. There are things that you can do, surgery, medical management, conservative modalities. This is our niche. This is how we think we can help you. And this is the information that we can supply to you. Links to our website, links to other like third-party sites that are like more legitimate. Some of these tertiary care centers, Mayo Clinic, Columbia, Mount Sinai, everyone has a ton of value that pretty easily accessible these days through the internet. So we're able to provide everyone with as much information as possible. And then that way we can make a more educated decision and approach to like tailored medical services.
Okay, that's fantastic. Yeah, and I'm sure, Dr. Kang, that even with all these educational resources and you guiding these patients, you must have had a challenging case, a patient that came to you, maybe they tried everything else and nothing worked. Could you tell us about a story about a particularly challenging case you had and how you were able to achieve success for that patient?
Yeah. So it's always a little nerve-wracking, especially when a patient says, hey doc, you're my last hope. I've seen 20 other physicians out there or I've gone to these really white ivory tower like institutions, academic centers, and you're like, hey, this is my last thing. Unfortunately, we've had several instances like that, but I'll tell you generally, as opposed to a very specific case on how we would deal with that. Number one, it's usually just gathering information. Just, hey, let's start from the top. What's the origin story? How did your journey take place? What things have you tried? What did work? What did not work? Who did you see? And then that way we're filling in the story and kind of getting the book. So for me, if I use an analogy of a book, okay, we're building our table of contents. And then let's see, okay, what are the chapter titles next? I saw this, I did this, I did this. Okay, let's try to put it into sequential order. And then my job is to say like, okay, how do I put everything together? Is there some gaps in this thing that I see? Do I have the skill set myself as a physician to really kind of take this on and manage it? And if I can't, then, or if I can, hey, it doesn't look like you tried X, Y, and Z. Maybe let's try that. Or, hey, I think you've tried everything, but I have a great other neurosurgeon or a physical therapist that may specifically be focused, or their niche is that particular type of thing, and I think you would benefit from it. And then that's when we would make a more appropriate referral out. For me, I like to be, I'm kind of my own patient myself. So just to kind of give you a quick specific example. So doing Brazilian Jiu Jitsu, again, yes, I do have a ton of injuries from it. I've torn my labrum in my shoulder. I recently I've been out for about 3 months now because I tore some tendons and some ligaments in my wrist. I tore my meniscus in both of my knees. And I'm my worst own patient, right? So I self-diagnosed myself. I did have physical therapy for all these injuries. I don't want to do surgery, but I did have surgical opinions. So I'm the one who has the worst amount of bias. But for me, it's probably, I'm the most difficult patient on my own because I'm trying this, I'm seeking this, I'm looking at this, I'm trying herbal remedies for here. And ultimately, usually I'll come up with something that helped. For example, Dr. Sharma did a PRP injection for my labral tear. I did some physical therapy. I did some acupuncture therapy, and all of that together really kind of helped me get back into training. And now I'm trying to do the same for my wrist.
Mm-hmm. Got it. Sounds like it's quite a journey that you've been through for doing that sport.
Yeah. I mean, the good thing about it is I'm able to relate to patients who have similar types of sports-related injuries because, hey, not only do I know about it, I've already done everything myself, and I've done multiple procedures, some on myself and some with my partners helping out, where we're able to kind of get me back on the path to recovery.
Got it. Now, you did mention before that the industry is always changing. So can you talk briefly about any new or emerging treatments that you're particularly excited about?
Yeah, so there's a couple of things. One is this regenerative medicine therapy that we quickly touched upon. It's not relatively new. It's been around for several decades now, but still it's not readily acceptable or accepted within the medical community, meaning amongst orthopedists, and generally accepted within like Western medicine, because there's not enough longer term, double-blinded, randomized, clinical studies that are out there. But specifically talking about PRP, stem cell therapy, regenerative medicine, where you're using your own body's cell line to help accelerate the healing process for yourself. This I'm super excited about. Before, in the past, when I first was introduced to this long time ago, right when I finished my fellowship, there was a time where I was doing the injections like we had discussed earlier, doing the nerve blocks, doing the epidural steroid injections. But then I was like, okay, I finished medical school. I feel like I have this gigantic toolbox, but I still felt limited. Like, what can we do that's a little bit more homeopathic or more natural, as opposed to this like medical managed stuff, and that's very like niched out and limitations regarding specifically. And then I started to hear about footballers in Europe, soccer players that were their team physicians were doing PRP, and they were doing ultrasound guided therapies. And this is, probably going on 15 years ago. And I was like, what is that? So went down that rabbit hole, got me really interested. There's been a plethora of stuff that has come out, and literature now, bedside units, bone marrow, fat, stem cells, platelet-rich plasma therapies, other types of amniotic stuff that's coming out. But now with technological advances in general, like gene modification, I really think that in the future, we're going to be able to do things and things that may be out into the future that we're going to be able to make that as injectable for ourselves. Just to give you a quick story, I have 3 kids, like you mentioned. When you're having children, a lot of the times the OBGYNs will ask you, hey, is there any interest on getting umbilical blood or placental tissue? And the question is, well, how much does it cost and why am I doing it? So there is a cost issue associated with it. It's not covered by insurance. But why do I do that? Hey, the theoretical thing is, well, if you're able to save some of the stem cells of your child and you're able to cryopreserve it, eventually, if there's some sort of maybe bloodborne disease like a leukemia, you could use the bloodline or the stem cells and possibly replicate it so that instead of getting a bone marrow transfusion or chemotherapy or other type of therapy for your child in the future, they might be able to manipulate it or regenerate some of the stuff through that bloodline. Whether or not that science actually becomes true or not is questionable, but it could be. So that's why for me, I have this, all 3 of my kids, I have this cryopreserved tissue plus blood. But ultimately, the same thing may be possible for us. And I think that's the most exciting part, because generally as you age, and the second part of your question that I want to answer is what's really more exciting to me is this concept of aging. Right now there's another branch of medicine that's really been taking off, more of a functional medicine approach, which is, hey, how do we get to the root cause of some of these diseases? How do we intervene early enough as physicians so that we're able to prevent some of these diseases, like maybe diabetes is an example, and maybe possibly even chronic pain. But for me, the theory behind aging is that recently there's been a different school of thought of that aging may be a process if you approach it as if it's a chronic disease and not as just like a kind of sunsetting event of life. Then can we make aging and the processes associated, can we kind of slow the progression? And orthopedically, where I think it really kind of comes into place is where as we age, what happens? Our body degenerates over time. So I can't walk, I can't sit, I can't stand, I can't even, if I have a carry-on luggage, I can't put it up into the overhead bin when I'm riding on an airplane. So part of my thinking is from this functional medicine standpoint, and if you're thinking root cause and you treat aging as more of a chronic disease type process and you change your mindset, orthopedically, how can we keep you as functional as possible? And I think really the wave of the future is going to be some sort of regenerative medicine therapy to kind of maybe not stave off, maybe slow the progression to the point where you might need a total joint arthroplasty. And right now, spine surgeries are still traditionally with cages, screws, support rods, etc. And it's quite debilitating to the body. And it's an involved rehab process. And obviously for patients that need it, it's absolutely needed. But if we can do other things in the interim to slow the progression to that point, and then keep us, and specifically say for myself, more orthopedically functional, I think that's the really exciting part of regenerative medicine as a whole.
Wow, that's fantastic. I mean, it's just amazing how the future of this industry is going. I mean, maybe we can live to 200 years old. Who knows?
Yeah.
Yeah. Now, Dr. Kang, I have one last question for you. But before I ask that, I want to point people to your website, which is coremedicalwellness.com. Now, the last question is, what is your most important piece of advice you can give to somebody who is suffering from pain, chronic pain, but they're hesitant to look for help?
Yeah. Number one, thank you for the plug. And number two, I think I'm a big Star Wars fan. And, I'm going to use the analogy of Luke Skywalker, Obi-Wan, Darth Vader, etc. The message that I want to convey to people is, even if you're not able to receive it directly with us, there's hope. You have to have that mindset that even if it takes 100 physicians or 100 practitioners to get out there, personally, I think it's really the mindset of hope, perseverance, and really kind of being able to chase the results that you want to get. And I think that's really the biggest thing. There's a bunch of books out there about athletes, their coaches, how, for example, Kobe Bryant was able to transform himself into Black Mamba, Michael Jordan becoming, Michael Jordan as we know, Prince Air. Things like that is all mindset driven. And I think, yes, as a physician, I have tools to help guide you in the journey of making progress. But no matter how much medicine or tools or techniques that we throw at things, if the patient doesn't have that mindset and is unable to change and doesn't have that sensation of that, yes, although it's far away in the tunnel, but I do see a light there, although it may be more of a circuitous path to get there, as long as the patient has the mindset and I'm able to convey that, yes, there's possibilities and hope that we can progress towards that light, I think is the biggest takeaway that I want patients to know, that yes, even though I might not be able to help you, there's going to be someone available out there that with a little bit of patience and a little bit of hope and a little bit of really perseverance, that they were going to be able to kind of get to that end stage.
Great. Well, there you have it. Dr. Richard Kang of Core Medical and Wellness sharing his experience with everyone. Now, Dr. Kang, where can people contact you or your practice?
The best one is through our website, coremedicalwellness.com. All of our info is there. Daniel and his team does a fantastic job keeping our contact information current. Thank you.
Yeah, great. Well, thanks again for being on the show, Dr. Kang, and sharing your message with the world.
Awesome. Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.